we generally want to look at symmetry of the body. So we talk about the right angle rule. And that's pretty simple. Imagine a vertical plumb line. If you were standing behind it, that would simply dissect your body into two compartments, a left hemisphere and a right hemisphere. And we want to look at symmetry at what we call the load-bearing joints. We're looking at the feet, we're looking at the feet and ankles, we're looking at the knees, we're looking at the hips, we're looking at the shoulders. And we want to look for symmetry. We want to see whether one shoulder is down, we want to see whether the body is swayed out, maybe they're standing on the hip shifted out. And we don't just do it from the front, we then turn the person to the side, and when we're looking at the side, we want to look at symmetry. Now theoretically, where symmetry exists on the body is that you should have your imaginary plumb line. If you look at this bone right here on the side of the ankle, called the lateral malleolus. So if you were to draw imaginary line kind of running from just in front of that, it would run through, if you were standing up, the anterior 1/3 of your knee. It should run through the greater trochanter, should run all the way through your acromion process, and if your head was in position, it would run right through the mastoid process, which is the bone right behind your ear. We'll just call it the earlobe, it's close enough. The whole idea is to do a quick assessment. I'm looking for 5 things inside of 5 minutes. Ideally, I'd like it to be even less than 5 minutes, but it just rhymes when I say 5 and 5. So what are we looking at? Well, the first thing, you're going to stand up, and if you're looking at the symmetry, I'm just going to look at quick observation. Do I see everything seem to be symmetrical? They might stand like this. And we notice that if you're drawing an imaginary line here, that the hips are off, right? Or they might stand, and because one hip is higher than the other, they're kind of standing right like this. Or they've got a little bit of scoliosis or things going on, right? So I'm looking at symmetry, starting with the feet. Do the feet appear to be somewhat parallel? It's okay for the feet to have a little bit of eversion. It's considered to be pretty normal, right? To have the feet at about parallel or about 8 to 10 degrees of eversion. Remember, on a clock, the 1 o'clock position is 30 degrees, so 8 to 10 degrees is just a slight outward rotation like that. Now, I'm going to look for symmetry there. I also want to make sure that if I was drawing an imaginary plumb line, that the inside of their ankles, that plumb line would intersect equally there and run all the way through pubic bone, belly button, sternum, all the way through the top of their head, right? We look for that symmetry. We can also, from the front, take a look at a lot of things quickly. Do the hips appear level? You can certainly put your hands on bony landmarks, put them on the shoulders to see whether it looks symmetrical. Now, generally, the dominant shoulder, which a lot of people is the right shoulder, might appear a little lower than the non-dominant shoulder because we generally use it more if you are right side dominant. And as a result of that, it's a little looser, so it tends to just kind of hang a little lower. Make sure that that appearance of the right shoulder hanging down is not the fact that trunk leaning that gives the appearance of that, but it's actually the arm, the shoulder joint just hanging over. And the way you can look at it is if I stand like this and I suddenly lean that way, kind of look at the gap between my torso and my arms. Look how this gap has closed, but look how that gap here has opened. So one thing to look for is if you see a shoulder that's down, simply look down at the arms. And if you see symmetry with the arms, where kind of the space appears normal, but you've got one shoulder that's higher than the other, that's certainly a dysfunction within the shoulder itself. It could be overactivity in the upper traps, things of that nature. But if you see something like this, or 2 things. Number 1, I'm not symmetrical. And number 2, that space between the arms is disproportionate. In a good postural position, your baby finger should align kind of with the seam of your pants, and your hands should ideally be placed facing palms inward. We see a lot of people like this. Generally, a lot of people train their chest and they train their lats, and they think agonist, antagonist. So, hey, I'm training balance. The unfortunate reality is they are both internal rotators of the arm. And so if you're overdeveloping those muscles, they're becoming so dominant that the antagonist, which in this case becomes the little rotator cuffs, your posterior deltoids, are having a tough time kind of holding that position, so the arms just tend to fall in this position. Now, key thing to look at is if you see the appearance of this, you've got to consider 3 things. Is it the spine that is actually rounded? Is it the shoulders that are actually protracted forward? Or is it simply the arms that are internally rotated? So you've got to kind of differentiate, because it could be one, two, or all three of those when you see the hands in this position. So first thing to look at is, where are the elbows? If my elbows are pointing backwards, right, then I should be in good position. Now if I'm forward and you just ask me to pull back my shoulder blades, my elbows, as you notice, as I pull back, my elbows start to point and orientate themselves backwards. But if I pull my shoulder blade back and my arms are still internally rotated, then it's a safe assumption there's something happening in the glenohumeral joint that is out of balance. If I pull back my shoulder blades and my arms tend to correct, then you can make the assumption that's happening something in the shoulder blades. And then, of course, if I pull everything back but I'm still kind of hunched over, then you can make the assumption that it's something in the thoracic spine. If I tell you that I'm about to do an assessment on you, you probably are not going to stand the way you normally stand. So try and make this as discreet as possible and just kind of catch things that stand out at you. If you're not certain, you think, well, is it not? I would say, don't worry about that right now. Look for the gross imbalances or the gross misalignments that tend to stand out.